So I'm really excited to introduce our ninth CCC speaker today, Dr. Joshua Weitz. Dr. Weitz is a professor in the School of Biological Sciences and Physics at Georgia Tech, and he's also the founding director of the Quantitative Biosciences PhD program there. And his work harnesses quantitative methods to interpret and understand complex biological systems. He works on theoretical ecology and evolutionary biology, disease dynamics and epidemiology, and quantitative viral dynamics, where he literally wrote the book on that subject. He was recently inducted as a fellow into the American Association for the Advancement of Science in 2017. And outside of science, he has really a prolific Twitter account, which y'all definitely need to start following if you're not. And he, one of the things I really admire about him is he really uses his platform to promote needed change, often writing op-eds and informative articles about, current topics. So for example, he's really at the forefront of promoting science and science communication. He was a speaker for the March for Science in Atlanta and often is, writing op-eds with current news about various science communication topics. He really is trying to promote grad student well-being, recently fighting to remove costly grad student degree expenses that are, I believe, at Georgia Tech, and then many other universities across the country have similar kind of degree costs. And then also most recently advocating for mandated masks in Georgia and on campus, really across the country for universities as they look to reopen. And that's just a few of the things he's worked to promote. And I just want to give a quick summary of some of his COVID work. I'm sure we'll hear about this today as well. He and his team have worked on reconciling reproduction number estimates from different sources and methods, especially during the early phases of the pandemic. Looking at how to utilize serological testing to slow the spread by potentially identifying who's already immune to the virus and allowing that to help slow the spread. And then one of my favorite papers I've seen from him is really looking at how behavioral change in response to news could alter people's behavior and ultimately change the pandemic dynamics to kind of have this interesting time lag between when mortality increases and people's behavior changes and then mortality decreases, and kind of these really interesting pandemic dynamics. Probably most famously on Twitter, at least, he has also been working to estimate the risk for COVID-19 at mass gatherings, and recently expanded that tool to this really very nice interface looking across the country. And I'm not sure which of those we'll hear about, but I'm really looking forward to hearing from him. And with that, I'll let him take it away.
Can you hear me, Spencer? That was quite an introduction.
Yes, I can hear you.
Okay, and thank you again for the invitation. I have a bizarre setup here where I have my iPad and I'm talking to that, but I have my other one for the presentation. And yes, we're doing a lot of things. On the other hand, your group does a lot of things. And so when I think about kind of where I want to pick and choose my spots, I often do look, Lauren, at what your group is up to. And when there's a New York Times piece about if there are no cases yet, you might have one. I mean, that to me is a great example of science communication early and trying to bridge that gap. And what we mostly work on is really viruses and microbes. That book is viral ecology, but yes, we have worked and continue to work on disease dynamics. I'm delighted to be here today. Let me switch over, and just to make sure I know the timing. It's 10:45 now. I thought this only went to 11. If that's true, then we might as well just chit chat. But can you clarify that?
It does, but we often go over, so just take your time. Yeah.
Okay. Well, I did set up a presentation. Can you see my screen?
Not yet.
Nope. Let me try that again. Try the button again. Share screen. That one should work. Can you see the screen? That's
yes.
Good.
Yeah.
And let me go into full screen mode. Can you still see it?
We can see it, but it doesn't look full screen to me.
It looks like Okay, it doesn't want to switch over. Let me try to load this with preview. Sorry for the delay.
It's okay.
Let me try it again. And on preview, how about this time?
That looks good.
That looks better. Okay, so Adobe, no, preview, yes. So yeah, we've been doing a lot of things, and we've started early thinking about R0 estimation. We've worked on asymptomatic transmission. Like you all focusing in Texas and Austin, we've been doing a lot of work in Georgia, and motivated in some sense. I think those of us who are in the South, or whether or not Texas is South or Southeast, et cetera, but we're seeing a different kind of dynamic and timing than those in the Northeast, and that certainly has colored my responses and need to engage. And yes, we are working on dashboard and communication. So I've decided to pick two of these. I'm not going to talk about that lag problem of mortality and how that might influence behavior. We're very interested in examining that. We're still revising that based on some feedback from reviewers, but also, frankly, given some analysis of data that suggests, like all things, the behavior is more complicated than our simple model, and we want to engage on that. So let me start with just a thing that I think you all know, that this is a global pandemic, and I know people say all politics are local, but in some ways this pandemic, all pandemics are local. We're getting these local experiences, and the more that we can localize and describe its impacts locally, I think it makes a difference. So let me just tell you about the Georgia case. In the last week, we've seen what had been a plateau, and we had been trying to explain to state officials and also university officials and those who would listen through public outlets, that even though this was sitting at a low level doesn't mean the risk had passed or it couldn't yet again increase, because we were, for the most part, immunologically naive. That has unfortunately begun to happen for all sorts of reasons. So we've seen an uptick in cases, in hospitalizations, and not yet fatalities. Those are often lagging, but we're beginning to see yet again the issues that we saw earlier in the spring. And as you just described, Lauren, there's a communication gap where we think, new transmission is down. That doesn't mean that the hospitalizations and the ICU admissions are going to immediately go down. There's a time it takes for that to process through the etiology of the disease. So the thing that I want to do today is really ask this question and then hopefully get some feedback, because there are things that I think we're doing well with respect to communication and even the modeling, and there's some places where I think there's really uncertainty. So looking forward to feedback. Really, I want to ask the question, how can we use data reports to reduce transmission? Not just to sit there passively testing to surveil, this is how things are now, but rather to use that to inform whether it's policymakers or the public to make a change to reduce ongoing transmission. And I'm going to do that in two parts. The first part, I'm going to talk about something that Lauren, you and I had written briefly in an AJC blog. I pulled you in back in March, and unfortunately it keeps coming back again. And the question is simply, what are the chances that one or more individuals in a gathering will be infected with COVID-19? This is critical at a fraternity party, at a school, at a business. I don't know if it's true at UT Austin, but certainly we've had some spreading related to fraternity gatherings here. I don't think we're the only ones. And I want to raise this not just as a communication tool, but there's actually a scientific question at the heart of it. How can we estimate, or how good are we at estimating circulating infections? I think that's a really hard problem. So I welcome input there. Part two will be, how can we get some sense of how many recovered individuals there are, those unlucky enough to have been infected but lucky enough to have been recovered, to reduce future transmission. And I think this question of estimation in part one and part two are related. So I'll try to do two brief things, given I know the limited amount of time. Sounds good? Okay. So yes, many months ago, we proposed a very simple model of, essentially a binomial calculation of trying to estimate why, even when case percentages were very low, as gatherings got big, and back in March, that might have been 1,000 or 5,000 person gathering, or even when there was still talk of March Madness, right, 100,000 person gathering. Why low incidence in the population could still mean somewhere in that crowd there might be someone who's infected, and that could cascade and lead to new transmission. Over time, we expanded this into more interactive charts, and then recently this dashboard that we go now to the county level. And there's a slider on the bottom left, and anyone can access it. We released this on July 7th, and we had this dashboard up before, but without the county view. And when we made the county view, things moved rapidly. Frankly, it crashed the site. We weren't quite ready. We were using our studio version that was more of a free version, which had 100 simultaneous users. We broke through that. We broke through many gaps. We've now had over 250,000 visitors in the past 24 hours. That is a tremendous amount of interest. So far, we're managing to deal with that. We may have to even expand. But as you can see, you can zoom in, you can change event sizes, and this is really just the 1 minus 1 minus p to the n calculation, right? What's the probability that one or more individuals, each of which has a probability p of being infected, may be sick in a group of size n? So it takes a simple idea, but then localizes it. We also connect to the New York Times, GitHub, and Atlantic, COVIDtracking.com to get data. And I want to talk about how we estimate p, right, to translate that. And our hope, again, for this website is that people see this and realize that actually a group of 50 or 25 is still not okay right now with respect to feeling comfortable that no one in that group would typically have COVID. I don't think that's the case at the moment. There's a lot of asymptomatic spread. It's getting out into younger people. And so our hope is that this helps people either reduce group size or take precautions. And there's many reasons why we thought it's problematic. Increased likelihood, obviously that's apparent. There's more interactions, right? More people, it goes like n squared, not perfectly so, but there's some higher level of interactions. And in places that are not classrooms or businesses where you know who's there, but in a bar or restaurant, you're not quite sure who's there. Contact tracing is already hard, but close contacts in a large gathering are even harder. So here's the thing I wanted to get your feedback on it. I'm happy, again, to take questions in the middle, because this is not a long slide deck. I've tried to condense it. How do we estimate P? And I don't know how you all are doing it, but we've done something very, let's call it simple. It's a bit of a conservative estimate. I've decided if I have a choice between trying to hit the mean or maybe being a little bit on the conservative side by overestimating risk, I'd rather overestimate risk by a little bit. I think we've been underestimating risk as a society for far too long, and that's not been a good outcome. So we use the last 2 weeks of reports. In other words, per county, we take the difference in cases now versus 2 weeks ago. Now, I recognize that probably peak infectiousness is mostly waning after 7 days, but that doesn't mean people wouldn't show up PCR positive or still be technically infected. And quarantines are about 2 weeks. We then take that difference in numbers and use a 10-to-1 reporting bias. We also know that the reporting bias, as per the CDC, goes from about 6 in Connecticut to 24 in Missouri. The median is 11. There's a lot of variability there. And we
Uh-oh, I just muted you. I'm sorry. I meant to unmute myself and I muted you. I was just going to ask you to tell us what are those numbers you're saying? What are the 6 and the 25? What are those exactly?
So the CDC did a serological survey where they went back and in 6 locales, 3 of which were metropolitan areas: Puget Sound, Miami, New York, and then 3 states, Connecticut, Utah, and Missouri. And they did this mostly in late March into early April, and then some into April. They went and did sero surveys. They just put out the data, and then they compared the sero surveys to the number of reported cases via PCR and found about a 10-to-1 underreporting level. Now, the tricky thing there is, of course, depending on the ways that people are beginning to test differently. As tests scale up, it may be that we're actually not 10-to-1 anymore, but I don't have any evidence to say we're not still at a big underreporting level. So I just want to, and we've been clear about that we are using this 10-to-1 level, which is what the CDC has been claiming based on their sero surveys. Others have said even higher. You know, the Stanford Ioannidis work suggested it was 40 or 50. We don't have evidence that it's that high or off, but we are using this 10-to-1 level. So we take PCR confirmed reports, multiply by 10 to get a sense of circulating infection, divide by the county population, we get a value for P. We've never published this just because I didn't think many academics were interested in 1 minus 1 minus p to the n. Maybe we should, but it raises, I think, real questions about nowcasting, not from fitting big data sets, but how do we do nowcasting? And there's also lags. There's lags on the PCR. There are also dynamic trends. We've made an implicit assumption about constancy, whereas if the epidemic is increasing, we're probably underestimating risk. If it's decreasing, we're probably overestimating. We know that, but we're not trying yet to integrate a dynamic model. We also have a communication problem or challenge. I wouldn't say it's a problem. Right now, we're communicating fairly well. 250,000 people per day. We have a team who've done this between a GIS analyst, Cleo Andres, technical staff like you all who are trying to have help. So that's really what I wanted to say about this. And I think this matters also for classrooms. I've tried to share this at Georgia Tech because people are trying to figure out a safe classroom size. And at the moment, I'm doubtful about extended indoor time given current circulating cases.